Good afternoon. My name is Michelle Lane. I am the Senior Director for Community Health and Wellness here at North Kansas City Hospital, Meritas Health. And I am so excited today for our speaker. Dr. Kelsey Crow is a chiropractor and acupuncturist who believes you can't truly find the root cause of an issue without looking at the whole person. Her passion for chiropractic care was sparked after her mother passed away from pancreatic cancer, which really changed the view in which she looked at health and wellness and how important the quality of life is that you have to live. She wanted a career that she could be actively involved in her clients' health and well-being beyond kind of this traditional medical model. And she really wants every single one of her clients to be able to live this precious time to their fullest potential. Kelsey is originally from Rossville, Kansas. She loves to read and play board games with her friends and travel and experience new cultures. She is a wealth of information, a wonderful practitioner, one of my friends, and also the vice president of the Council of Chiropractic Acupuncture. She teaches basic and advanced acupuncture courses at the Cleveland University in their post-grad department, and we are so grateful for her today. So please help me welcome Dr. Kelsey Crow.
Today's topic is bridging the gap between traditional and modern medicine. We're going to go over a little bit of what acupuncture is, the history of acupuncture, how it came about, some things acupuncture can help, such as what is approved by the WHO. Then we're going to go into what a typical treatment would look like if you were to go see an acupuncturist. All of us treat a little bit differently, but what a basic session would kind of look like for you. And then we're going to finish with some take home points. So that way you guys can start doing acupressures, not puncture, but acupressure on yourself starting this afternoon or right after you watch this. So that being said, I think we're going to go to the next slide here. As Michelle said, my name is Dr. Kelsey. I am at your Wellness Connection. So your Wellness Connection is in Shawnee. We are about off 75th and Switzer Road, for those of you that know where that is. As she said, I'm a doctor of chiropractic. I do have my diplomate in the American Board of Chiropractic Acupuncture. I'm a fellow of the Acupuncture Society of America, and I do sit as the vice president for the Council of Chiropractic Acupuncture. So acupuncture is a topic I love. I talk about it a lot. It's one of my greatest passions. And that reason is because it treats the person as a whole. So we try to look at whole person health and well-being and what that is. So you can also, for those of you that can see me, there's a little diagram behind me in this office here that I'm in. And we like to treat the whole person. And we say that everybody has 4 different quadrants in their life that they need to be healthy. And that's not just going to be one part of your area. Like if your like physical body is doing well, but your mental body is not doing well, what do you need for help and resources to help you in that area? So this is what our philosophy is here at your Wellness Connection. We have 4 different quadrants. As you can see, we have the mechanical or the physical body. So that would be your physical pain, if you're having any ailments, headaches, that sort of thing, if you're having back pain. Chemical is what we put in and on our body. So that's making sure you're taking supplements. If you need supplements, you're using proper lotions and aesthetics care and eating the right foods. And if you have food sensitivities, where is that coming from? That's your chemical quadrant. Your energetical quadrant is your life force or your vitality, which is where we're really going to focus today with today's talk in Chinese medicine. And our thought and philosophy is that there is energy that you're born with that you lose when you die. And some people call that your soul. Some people call that your life force. Some people call that your chi. And we're going to be using that as chi today. That topic is what we're going to be discussing. But that is your energy portion. So in that energy life force area, you're going to have your feng shui practitioners, your yoga people sometimes, your reflexologist, acupuncturist, like that sort of thing. And then your psycho-spiritual is your mental, emotional awareness. And these are going to be your life coaches, your mental health therapist, psychologist, that sort of thing. So you need a whole team is what we believe to have whole person health. And not one can excel without the others is our philosophy. And that philosophy is actually truly built on traditional Chinese medicine. So what is traditional Chinese medicine? Or TCM, if you guys have heard of TCM before. TCM is the way to treat the body as a whole to help balance and prevent illness and achieve balance within the body, both the mind and the spirit. So in TCM, you might have, for an example of this, is you might have something like anxiety, and your anxiety is causing you not to sleep well, or maybe your energy starts getting off. Well, then maybe you get like depressed, and then your cycles are off, and it takes the whole person approach. It's not just, oh, all of a sudden I have amenorrhea or dysmenorrhea and my cycles are off. If you're female, or if you're male, maybe your testosterone levels are low or off or something like that. Then we try to look at the deeper root cause of why that might be the case. And that type of medicine actually started 2,000 to 3,000 years ago, and it's still relevant today. Acupuncture is a key practice in TCM. So TCM is a broad scope of treatment practices. You can have anything from herbs. So a lot of traditional Chinese medicine practitioners are going to be giving their patients herbs to help balance their body. You're going to have cupping, which cupping I know is a hot topic right now. It's going to talk about sports and things like that with dry needling. You can have other topics and other practices like moxibustion, which is burning an herb over the skin to help warm people. So acupuncture is just one little key that is, as a whole, traditional Chinese medicine. Traditional Chinese medicine, they had something called tuina, which is actually a physical manipulation of the body, which is a lot like your chiropractic adjustment. So that's where, for me, chiropractic and acupuncture come hand in hand in how to treat the whole person as a whole. So to first understand what acupuncture is, you have to understand what qi is. So we talked earlier that qi is everywhere, and it can take many forms, and some people call it the life force or the soul. The technical definition of it is a bipolar electrical energetical power flow. So it is the power flow that makes everything in your body work. It most is accurate with the nervous system. So some people ask me, how does this work with Western medicine? And a lot of times you look at how the individual needles are placed and where they're placed. So qi runs in the body and regulates the whole system. What nervous system in your body regulates the whole nervous system, or the whole system? And it's the nervous system. And so looking at that nervous system and looking how it's affected with individual acupuncture points and needles are very important for research and people that are looking into why and how acupuncture actually works. Acupuncture is the use of small, sterile, one-time use needles in specific points along the body to help balance the body. I do have people ask me, do you use the same needle over and over again? And the answer is no, that's not sterile. So we are very careful about keeping the sterile field clean, keeping our patients clean to reduce risk of infection and any sort of harm that may happen. So what does a traditional treatment look like? Because I was talking about how we dive deeper into the philosophies and how you look at the whole person as a whole. So how do you do that outside of just answering and looking at questions? And so one thing that a practitioner does is we actually look at the tongue and the pulse. It's used to determine where the energy is not flowing properly. So I like to tell my clients when they walk in the door that if they have energy off in their system, when I take their pulse, I use 3 fingers on both wrists, and I'll feel one side, I'll feel the other side. It's a reflection of their energy. Their tongue is a reflection of their energy, and it helps me determine if things aren't flowing properly and in the right direction. So you think of qi kind of as water, and water's flowing in a river. And sometimes it's really stagnated and it's really slow, or sometimes it's really rough and tumultuous, or sometimes maybe it's hardly there at all or overflowing the banks. And so my job is to determine where that's happening and why that's happening throughout the body. And then using different acupuncture points like work as like levies. So I have points that are very specific towards reducing energy or moving energy to different areas or increasing energy in one spot and helping it cross the body in a different way. And so my job is to find the acupuncture point that I would like to use to help move the energy system around. In doing that, principles such as the yin yang theory, the horary cycle, and the five element theory are all used to help determine where the needles will be placed. Like I said, it's very specific. So it's different than dry needling, and that dry needling is going to hit the muscle belly and in the area of pain to reproduce a pain receptor to the brain and a muscle fiber twitch to decrease the acid in the muscle. Acupuncture is different, and that sometimes points that are not local to the area can cause a huge response. It's shown that there's a point on the top of your foot that actually affects your eyes, and it's shown now with imaging and CT scans that when you needle that point, the part of your brain that lights up is the eyes. And so following those pathways are very different. So the points can be all out over your body, not necessarily just directly over the area of pain. That is another question that I get quite a bit. So I talked about the different theories, and one of those theories is a theory of yin yang. So I'm sure most of you know the yin yang symbol that's going to be on the left side of your screen. That symbol is very special in Chinese medicine because if you look at it, nothing is all yin or white. It has a black circle within it. So there's, the white is yang, and there's some yin in it. Or you have the black part of the fish and the black part of the circle that is your yin side, but nothing is ever all yin, and it has the white dot that's yang within it. So it's very important to look at this balance, to look how much yin is on one side versus yang, and to see where the deficiencies and the excess may come from. That's one part to start looking at. The next part is something called the five element theory. So the picture on the right is something that we look about in Chinese medicine. You've got two circles. You've got the black circles on the outside is how you build energy in Chinese medicine. So you have different meridians is what it's called. And those meridians correlate to different elements. And when an element is out of place or out of pull, maybe it's because that black circle on the outside, the black dots aren't flowing properly and generating properly. Or you have the star in the middle, and the star in the middle, the red star, is how things become pathologically out of place. So you can start having energy move in the wrong direction or force things in the wrong direction. So like in Chinese medicine, for one tiny example here, we have metal down on the corner, the right lower corner that would go up to wood. And so like an axe can fell a tree, an axe can make the tree fall down. And so, and metal, an emotion of metal is lung, and the lung is grief. And so if someone has a lot of grief, it can actually affect the wood, which wood is anger. And so if you have too much grief, a lot of times you'll see people with a lot of grief then have anger regarding different situations in their life. And so to help follow that back, that chain of command back, and to actually find the root cause is where it is important for a practitioner. One of the last theories that we have is the midday midnight law, or the horary cycle. So each meridian has a corresponding time on the energy cycle that it's active. This can be useful in diagnosis of symptoms for your practitioner. So say you only have heartburn or something like that on the stomach meridian at 7 to 9 a.m., then you'll know that 7 to 9 a.m. is your primary cause. And it's it's really useful for practitioners to figure out which points would be used in treatment and what time of the day the treatment would both be most significant. You can treat during the time or directly across the pie. So say someone's having insomnia and they're not able to sleep very well, and they're not sleeping from 11 to 1 at night. Well, I'm not practicing at 11 to 1 at night, but I am practicing at 11 to 1 during the day. And so that is where it can be important for me to be like, hey, try to come in over your lunch hour. We're going to try to target this transition of gallbladder into liver and make sure the energy is flowing properly around the cycle. So this is just an example of what the meridians kind of structure looks like. There are 12 basic meridians that run in a cycle throughout the 24-hour clock for us. So then people ask me all the time, what can you treat, or what is proven to be used for acupuncture? And so the World Health Organization did a study on acupuncture and its uses in 2003. And they found over 43 diseases or conditions or symptoms that are treatable with acupuncture. This is not, I would say, this is not just a complete list. I see so much more than this. But this is what the WHO is 100% like backing. So we have amenorrhea, anxiety, asthma, Bell's palsy, cancer-related pain, cerebral vascular accidents, chemical dependency, chemotherapy side effects, cold, cough, cystitis, depression, dermatitis, diabetes, dysmenorrhea, dysuria, endometriosis, gastralgia, GERD, gastroreflux, headaches, and heart disease are just some examples. It can help us so much. There are actual practitioners out there that specialize in cancer-related treatment, pain, and chemotherapy side effects. And so if that's you, or if that's one of your family members, try to look for one of those practitioners that specialize in cancer-related pain specifically, because there's so much going on. Some more are hepatitis, herpes, impotence, fertility. Infertility is actually one of my favorite things to help with. I find it personally very satisfying when someone comes in and I'm able to help a new life come in. IBS, your bowels and your GI system or your gastrointestinal system is one of the I wouldn't say easiest, but quick turnarounds that we have in Chinese medicine. So if you're having any sort of IBS symptoms, I would definitely say, or throwing up or burning in the stomach, that's definitely something to think about. Influenza, it's definitely this time of year. Inflammatory bowel disease, kidney disease, multiple sclerosis, musculoskeletal pain. So as a chiropractor, I would say this is my specialty, my bread and butter. And any other chiropractic acupuncturist, this is probably what we see the most of. Nausea, neurogenic pain, oncological pain, palliative pain, PMS, psoriasis, rheumatoid pain, shortness of breath, and vomiting. So the list is extensive. It doesn't stay to just one little area. And I would suggest, kind of looking at it for your family and seeing if this is an option for you. So what does a session look like? Sessions, typically you come in, a practitioner is going to take your tongue and pulse, like I was talking about earlier. You're lying on a table that's very comfortable typically, because you are going to be laying there for about 30 minutes. It depends on the practitioner. I like to do 30 minutes. Some people do 45 minutes. It really just depends on what you're trying to treat at the time. You might be on your stomach. You might be lying on your back. You'll probably have pillows and cushions and blankets around you to help you feel comfy and cozy. The needles are very small. They are completely solid, so there's not a hollow needle in the middle. A lot of people ask if it's similar to getting a shot, and that's very not true at all. The shot needles have to be much larger. They're actually pushing something into your body, and or if you're getting something taken out, if they're doing like a blood sample or a blood draw, that's obviously going to be a much larger needle than what these are. So these are just thin needles that are actually similar to the size of a human hair. So if you look at the thickness of your hair, that is the thickness of some of these acupuncture needles. Very, very tiny, especially the ones that go on the face and in the ears. We try to keep them very tiny. Once you're laying there, you'll be relaxing for about 30 minutes. And then after your session, the acupuncturist will come back in, take your needles out, and then they'll give you food, herbs, and teas to try. So during that 5 elements, I was talking about the different, how things can overact on one another to make things start to go out of rhythm or out of sync or not work and flow in the proper mechanical way. Foods can actually really help that. For example, if you're really needing to build blood and say you're anemic and you're having really hard cycles as a female, like berries are going to be your best friends, really dark berries and that sort of thing. So it just depends on what type of situation you have going on personally for you. So someone with shoulder pain may come in and I'll find something different than the next person with shoulder pain. Just because they both have shoulder pain doesn't mean their treatment is going to be the same. And it doesn't mean that their herbs and their foods are going to be the same that they're going to try at home. It's very unique and specialized to their person. It's not like a Band-Aid approach per se. And so that's where it's going to be really important for people to do their at-home work as well, to nourish themselves and to give the food that's going to help balance their body. For a lasting effect, clients may need to be seen multiple times, 1 to 2 times a week for a couple of weeks is sometimes how it goes. It just depends, again, what's going on. It's very hard for me to tell you, like, you're going to be coming in twice a week for 4 weeks or something like that if I haven't seen you, because I'll have people ask that question. And if I haven't seen you and I don't know what your energy's like, it's very hard for me to describe what's going to be like, but that's more than likely the case of the first set of treatments anyways. Lots of water is needed after a session. Stay hydrated. It actually gets a lot of your lymph moving. It causes local receptors and things to that where the needles are placed to change and move and influence the body as a whole. But that being said, you need lots of water. I say it's similar to getting a massage, where if you don't get one, you'll be able to feel dehydrated the next day. So if you don't drink a lot of water. So lots of water. Warm water is my key. I don't have it in my slides today, but warm water, especially this time of year, is very important for individuals to stay warm, but also to digest naturally and to be able to use their energy in a proper way, because energy will start to slow down as it gets cold, and we don't really want slowing down of energy and stagnation of energy. So I like to tell them to do a lot of warm water, especially the 48 hours after a session. So that being said, that's kind of what a typical treatment looks like. Now I want to go over some at-home treatments for all of you, for you to see what it's like to maybe experience some benefits at home without a practitioner helping you. But so to best to receive the energetical benefits, you're going to stimulate each point for at least 20 seconds at a time. I tell people to do up to 60 seconds, like up to a minute. If you're actively having an anxiety attack or actively having a cold or something like that, it may be beneficial to hit for a minute and then relax it and hit it for another minute, and do that 2 or 3 times just to kind of help individuals out. So I'm going to go first over the acupuncture points on me. So I'm going to make my screen bigger here. I think all of you can see me better now. I'm going to go over the location of the points and how to find them and where you would pressure on them. And then I'll go back to my slides so that way all of you can read that if you would like. But GV20 is also known as Bai Hui. Bai Hui is at the top of the head. So it's up here. So if you take your thumbs and you put them on top of your ears and you go to the apex of your head, or the very top of your head, that crown, you might be able to feel a little divot for some people right at the top of your head. And you're going to tap it like this. This point is important for focus. It's for memory. It's creativity. It is the 100 meeting point in Chinese medicine. So it's where all of your meridians of your physical body and all of your meridians of your astral body all meet into one. So it's huge in balancing. It's huge in helping anything that's starting to go down. So if you're having hemorrhoids or prolapse of anything, this point is going to help bring up and tighten your energy. It's really, really useful in memory. If you know of any students out there, if you got high schoolers, people going to college and they're studying a lot, this might actually be very tender on them. When I was going through school studying Chinese medicine, I would always hit it before an exam, and it was always super tender. So I just like to tap it on top of the head. The next one that I wanted to talk about was CV17. It is the front point for Qi. It's the influential point for Qi, and it helps raise the body's energy. So Qi is what we were talking about, is the life force. It's the energy system of the body, but Qi can also be used as your kind of energizer bunny point. So this is the point where I'm like, if you're exhausted and you're tired, this is the point you're going to need to hit. So for women and men alike, it's easiest to follow if you find the middle of your sternum and you go down Right in the middle, you're going to find this divot or this tender spot. You're going to go until you find it's tender. For men, it is going to be about nipple level and the depression between your breasts. So that's going to be the easiest for you. But for women, it's going to be right in that divot that's really, really tender a lot of times, especially if you have any sort of fatigue or tiredness. So a lot of times I like to tap this. You can massage it, but I like to tap it just like this. And then that's going to give you that boost of energy without taking any sort of medication or drinking more coffee or something like that that might dehydrate you. This is your natural energizer bunny point. So I'm going to go back to my slides here. So that is the first two that we talked about, GV20 and CV17 or conception vessel 17. The next ones we're going to talk about is actually called Buddha's Triangle. So Buddha's Triangle is heart 7, pericardium 6, and lung 9. So to go over those points, we are going to do heart 7 first. So heart 7 is also called Shenmen. Shenmen is on your wrist crease. So if you bend your wrist, I don't know how easy it is to see for you guys on my screen here, but if you bend your wrist and you go all the way across those wrist creased right under your pinky side of your hand, of your wrist here, there's going to be some tendons, and it's going to be on the inside of that tendon on the medial or on the middle side of your wrist. That point is to help bring down anxiety, and it calms the mind. This point is called Shenmen because it means mind, heart, gate, mind, heart, palace. It really is supposed to help bring that mind space into your heart space and really, really, really calm you down. There is actually a Shenmen in the ear for people that do auricular therapy. We'll talk about it here in a little bit, but that's how important Shenmen is there's not only one on the body, but there's also one in the ear. So this point is really, really important. Pericardium 6 is located 3 finger widths. So if you take your 3 fingers like this, you put them in the middle now of your wrist, and it's right where that third finger lands, right in the middle of your wrist. For some of you that have had C-bands or get motion sickness and you have those bands that have the little buttons on them, that can actually sometimes land right where this point is. This helps bring down tightness in the chest as well as nausea and heartburn. So that's why it's important for people that are having any sort of nausea, if you're seasick with the bands, motion sickness. I know my mom used them a lot going through chemo, and it helped with her nausea with the chemo medication, and or pregnancy. This is a safe point in pregnancy, so that would be very important to find that point there, 3 finger widths down. The last one is lung 9. So it's actually on the other side by your thumb, on your thumb side of that wrist crease. You should have a little box here where there's not a lot of tendon, a little like divot area. All acupuncture points are in little divots. And this point is going to be used to help anxiety, but also that like breathlessness that people will get sometimes with anxiety. So these 3 points together, one helps the heart, one helps your the protector of the heart. The pericardium is known as the protector of the heart, and the other one helps the lungs. And so all 3 of those together are called Buddha's Triangle. And Buddha's Triangle, you can either try to do like we're doing right now and just hit them individually, or I know some people that kind of do this maneuver and you'll try to hit all 3 points, like crossing your arms over at one time. Say if you're in a plane and you're terrified or something like that, and you want to have a little bit of stress relief at that moment. Exactly. Those are the 3 points that you're going to hit. The next ones are actually very, very important to go over, but I also want to warn people there are points in Chinese medicine that you're not allowed to use on pregnant women. So if you are pregnant, the next ones I do not want you to do. The next slide will be like a little bit more cautious for those people because they're so important points. They do a lot. They're called master points. They move a lot and they make you really healthy. But because they do so much, you don't want to endanger the mom at all. And so that's where, if you're pregnant, please don't do these. The first one is going to be large intestine 4. Or Hegu. I like the name Hegu. Hegu is, so if you squeeze your thumb together like this, and it's the highest mound of that muscle flesh in your hand here. It's a master analgesic point for reducing any sort of pain. I know a lot of people have heard this point probably for headaches, but it helps reduce inflammation and energy, and it elevates the mood. So it's really just a good overall point. If you hit this point and the next one that I'm going to do, stomach 36, if you hit both of those together, you've basically treated the whole body. But it's a very, very important points. The next one is stomach 36 or Zusan Li. So Zusan Li, if you take your hand like this and you're going to place your top of your hand like this on top of your knee. So if this is your leg and your knee, you're going to place it here and it's where your pointer finger lands. So I don't think you guys can see me, but if you're doing it at home, you can place your hand on top of your knee and it's where your pointer finger lands. Some people feel where their middle finger lands. If that's more tender, then just go ahead and push there. But that's the easy way to find that point. It's also a master analgesic point. Analgesic means pain, so pain reduction. It's a master pain reduction point. It treats anything from the neck down. So when you are using stomach 36 and it's treating from the neck down, and you're doing large intestine 4 and it treats anything from the neck up, like I said, you're treating the whole body right there. Just 2 points. And then the last point that I added in was large intestine 11, because large intestine 11 is so important for individuals that are sick. Right now, I feel like there's a lot of flu going around, so I thought it would be very important for this time of year. But it is your number one immune enhancing point. It's there to help and fight any illness in the body. What you're going to do is you're going to bend your elbow and you're going to see where the crease is that comes down from your elbow crease. And it's going to be halfway between that and your actually olecranon, so your actual elbow bone, and you're going to go halfway through and it's right there, right in the middle of your arm. Some people go like this and they pinch here and it's going to be right in the middle of your arm, right at the outside edge of your elbow crease. That is going to be huge. Like I said, if you're fighting anything off. So people that have allergy type symptoms right now, if you're having the flu, anything like that, it's going to be very, very key. So I'll share my screen again. So that way you guys can all read those really quick. But like I said, large intestine 4 on the hand, stomach 36 on the leg, or Zusan Li. Fun fact about stomach 36. Stomach 36 is called Zusan Li, which is supposed to be 3-leg mile. They say in Chinese medicine that if you were a soldier on the battlefield and they needed you to march 3 more miles, they would needle that point on the soldiers and they were able to do it. So that's why it's so important in pain reduction and just vitality of the body as a whole. Okay. And then my last tip and trick that I had was the ear massage for everybody at home. So if you've maybe heard of ear reflexology, ear points, that sort of thing, a lot of people have heard of using ear points for weight reduction to help with like pain. At the VA, I know that they do a lot of something called the battlefield acupuncture, and battlefield approach is actually using needles inside the ear to help reduce pain. It's really used for like drug and alcohol and substance abuse disorders, because when you're a practitioner and I have a little ear seed and I'm putting a seed on your ear and you're going home with it for a couple of days, the results are longer standing than just like an individual treatment. But that being said, you can treat the whole ear and treat the whole body with just the ear. So there's reflux for every structure in the body, every organ, and every emotion. To receive a full body relaxation benefits, what you're going to do is you're actually just going to massage the ears. So you're going to go inside the ear, outside the ear, apply a gentle pressure to wherever you feel pain or tenderness. This will send a signal to the brain to then treat that area of the body with circulation, immune system modulation, and chi help. So I guess I'm small again, aren't I? I'll make myself large here. That way you can see a little bit better. But you're going to actually, some people just massage on the outsides of their ear. You're actually going to want to massage their inside too, because all of your organs on the inside of your ear. So you're going to want to massage on the inside, on the outside. Some people pull on their ears on all directions. and it's going to be very beneficial to treat. If you're feeling pain anywhere, so like if you go across from the tragus and you start to feel pain right here, this is your shoulder. So if you're having shoulder pain, then you would want to massage this area, and you might have a little nodule. Maybe you have a nodule on one side that you don't have on the other side, and then that's going to be important for you to just apply a little bit of a pressure. Don't go crazy. I have some people that I'll tell them to massage this at home and they'll start digging their nails into it or something like that. You don't need to hurt yourself, don't hurt your ears, but do just apply a little bit of gentle pressure, and that can actually see a huge benefit throughout your entire system. All right. I'm going to remove the spotlight here. And we're about 40 minutes in. And so I had any questions for you all. If you guys have any questions, I would gladly take and help answer any of them.
Okay, let me start by first telling you how helpful that was. I was chatting with you before we got started about my shoulder pain. So then when you said that, I was like, and I have a nodule. I have a nodule on this side that I decided to be a cross-country skier for the weekend when I crashed. So that is amazing. We'll see if anybody has got some questions here. I wrote down a couple of my own. So when you're doing the tapping, right, and you're applying pressure, is there a rule of thumb for like 30 seconds, or how long should I be doing that for?
Yes. So I say anywhere over 20 seconds.
Okay.
So you could do it 30 seconds, 20 seconds, up to a minute. If you're tapping,
Uh-huh.
the rule is 3 sets of 3.
Oh, okay.
So if you're tapping and not necessarily holding pressure, you'd go 1, 2, 3, 1, 2, 3, 1, 2, 3, to help tap. But
Okay.
I say also you're not puncturing the skin, so do it as many times as you need. That gives you comfort.
Yeah, absolutely. There's some recent research about using tapping methodology in classroom settings to try to decompress and calm the students before they're getting ready, to work. I'm sure you're probably familiar with some of that, but it's so interesting.
Yeah.
We've got a question here. It asks if you have any experience with chronic vomiting syndrome. Have you ever worked with anybody with that?
Yes, yes, I have. And vomiting a lot of times is your stomach chi going the wrong direction. So that's something that I would look at anytime you have anything coming up. Like if you're coughing, if you are vomiting, if you are having hiccups, if you're anytime you have that sort of happening, we call it your chi is rebelling. And
Oh,
so to help that rebellious chi calm down would be my job to figure out why and how that's happening. But yes,
okay, I love that. That is
yeah,
so great. And I love the Buddhist triangle. I think probably all of us were, doing it as we worked with you, and I was doing all sorts of weirdness there too. I think that they're to try to reach to it, but I think that there is divots, right? I think you're right. There are little divots to find that. Do you have any resources that you recommend, any books or like quick guides that would be something we could pick up at the library if we wanted to learn more? Anything you think is really good?
oh, for patients,
Hmm. And you can give it a thought and then shoot it over to me in an email, and then I can just include it with the video. If there is some sort of guide that you're like, oh,
yeah,
this is nice and straightforward for, something simple. Let's see
yeah.
if we've got any other questions. Somebody asked if insurance covers any of your services ever.
It depends on your type of insurance that you have. I personally do not accept insurance,
Hmm.
but there are practitioners out there that can make it work. It just depends on your state. It
Yeah.
depends on, I know Kansas and Missouri, I know we're right on that line, but Kansas and Missouri have different rules. The VA most of the time can get it covered. So I've had patients that are from the VA and they'll submit for community care. But for individual insurances, it's so hard to say. And I've been working on that. That's actually what the Council of Chiropractic Acupuncture does is we go to DC and we lobby for rights. And so
Mm.
we actually have a bill out there right now to try to make it more affordable for individuals on Medicare. And so we are working towards it. We're really trying, but it's not necessarily a common coverage right now.
Yeah, absolutely. I think that that's a struggle across the board with any of these alternative medicines, and they're not new. I mean, Chinese medicine, like you said, has been around for years and years, but the traditional setup for our reimbursement is different, right? So yeah,
Right.
well, I commend you. This was so helpful. I don't see any more questions, but thank you so much. I will put this recording into a YouTube and I will send it out to all of our viewers so they can share it with others, and your contact information for follow-up if anybody else has any other questions. But thank you so much. I appreciate you, Dr. Crow. Everybody have a wonderful day.
Bye. Thank you.
Bye-bye.